So thanks everyone for joining us. We'll be talking about nutritional and behavioral support for people with Down syndrome, and there are some special nutritional and health needs that these folks have regarding their immune system, their cognitive support, muscle tone, slow metabolism, and several others. So we're going to be covering that and the good results that some folks have had with their children. So until Linda's able to get through, I had asked Linda about what the goals are for parents of children who have developmental disabilities, and she said, we want to provide the life skills and whatever support we can so that our children can fit in. We want them to be, when they're in school, to fit in and be invited to the birthday parties, to fit into, the school activities and to be, part of the teams and part of the activities. And second, she said, we want them to be happy. We want them to grow up to be happy and fulfilled in their lives. And she said, and to be accepted as valued members of the community. That's really what everybody wishes for their children, just like everybody else's children, right? And so the purpose of this presentation is to share ideas on raising and guiding and teaching people who have Down syndrome and to understand the role that diet and vitamins can play in supporting their health, affecting their behavior and their cognitive development. Linda did some research on the incidence of Down syndrome, and she was telling me that when she was executive director, that the incidence of children with Down syndrome at the time was about 1 in 800 children. And then she said, as the years went on, that number got, I don't know whether to say larger or smaller, but it was the incidence increased. So then it was 1 in 750, and then she said today it's 1 in 691. It's about 400,000 people who have Down syndrome. About 6,000 are born each year. But she said that those numbers are really quite startling because she said the amount of prenatal testing has increased. And 90% of women will end their pregnancy if they are told that they are carrying a child with Down syndrome, which is really a sad statistic because they are really quite delightful people. But she said that if mothers know that they'll be giving birth to a child with Down syndrome, she said it is really important that they do everything they can to give their child as much nutritional support as possible, because she said many of these children will be facing some medical intervention and even some surgeries, and you want to help their bodies be as strong and as healthy as possible. So Lydia's story, and I guess I'm going to ask you, Angie, to share that.
All right, well, I feel comfortable doing that.
Oh, good, okay.
Okay, so Lydia, like Barb said earlier, she's 35. She graduated from a community college. I think she was the first person with Down syndrome to graduate from that community college. So she has her associate's degree, which I think is amazing. She's employed full-time with the county government's office right now. So she has health benefits and, pensions and all the other good things that come with a full-time job. She enjoys the same things that other 35-year-olds enjoy: cooking, reading, swimming, dancing, going out with her now husband. She got married in April. That picture you see there is her husband, Tom. I keep thinking I'm going to say boyfriend because it's still so new to me. It was in April. And Lydia, like it says on the slide, she's made several presentations about her life. She's spoken in front of groups of 700 people, and she ad-libbed. And I mean, she made up jokes on the spot, which is like, you put me in front of a crowd of 700 people, and I'm shaking.
And you freeze, right? Yeah.
So she's just quite impressive, and I feel like I can tell if you get an email from her or you read one of her stories that she writes or you were even talking to her on the phone, you probably wouldn't know she has Down syndrome. Her speech and her her writing ability is amazing. She's quite the lady and just pretty impressive.
And charming. And fun and happy. And well, there are special health challenges that people face who have Down syndrome. Starting with, they have a weak immune system. And Angie, can you speak to any of these?
Yeah, I can try.
Why don't you tick through these? Mm-hmm.
Okay. People with Down syndrome, they're, like Barb said, they have a weakened immune system, so they're quicker to get colds, but they also, their cold might last 3 times as long as yours or mine might. They have a slower metabolism. So my mom.
Are you guys done?
Yeah, hi, Mom.
Linda, there you are. Oh, good. Can you see the slide?
Okay. Yes, I can. I'm sorry. Telephone and computer problems tonight. Okay.
Of course. Don't worry about what. Angie's doing a great job. But go right ahead.
I can hear her. Okay.
Well, she'll finish weakened immune system, and you hop in with cognitive impairment.
Okay, no problem.
Mm-hmm.
Okay. Actually, I was already going to move to the next bullet, so you go ahead, Mom.
Okay. People with Down syndrome have a cognitive impairment and also early dementia. Usually Alzheimer's will often start about 20 years earlier in people with Down syndrome than it does the regular population. They have a slowed metabolism, which obviously creates issues with weight and obesity. I give always the example that if you ate a chocolate chip cookie and only had to go up 1 flight of stairs to work it off, let's just say, a person with Down syndrome like Lydia would have to go up the stairs and then down the stairs again in order to work off the same amount of calories that you have to work off of. So their body's just working a lot slower to metabolize. They are hypotonic, which means their muscle tone is very, very, very poor. It's very when she was born, she was sort of like a rag doll. She didn't have that nice firm muscle tone, and that they continue that throughout their life unless they get they work on it. The joint and arthritis problems are very common as they get older. So that's something that also has to be kind of worked on. It has to do with inflammation of their joints. And their joints oftentimes are not, some are more flexible than others and some are less flexible than others. So they do have some joint issues. Constipation, when I was the director of the Down Syndrome Association, I got a lot of calls from parents talking about really concerned about constipation, and it does seem to be part of those digestive issues that they commonly have, the gluten intolerance, the sensitivity to food, that kind of stuff. Their digestive tract often is impaired in one way or another, and that will cause like constipation most likely. So they have to make sure they eat plenty of fiber and, to keep them not constipated. And then sleep seemed to be another issue that I heard a lot about. They more often have sleep apnea than the regular population. And they also a lot of times have poor sleep habits. And by that I mean I heard a lot about kids who would get up in the middle of the night, kids who would just start playing with their toys in the middle of the night, or we have some escape artists who try and get out of the house. And so their sleeping sometimes is interrupted or poor. Parents were putting locks on their doors. They were putting, bars on the kids' beds so that they wouldn't get out. So because of that, you see a lot of kids really seeming sleepy and tired and unhappy. So they do have a sleep problem often. Not all. Now, none of these do all of them have. So I want to clarify that. And then the dry skin and eczema is another common problem.
Great. So dietary recommendations for people with Down syndrome are pretty much like dietary recommendations for everybody else. We all want to be eating, really reduce the sugar and the refined carbohydrates. They tend to deposit fat, especially around the waist. And the ideal diet for all of us should be eating the way nature has brought food to us, food that grows out of the ground, the primary source of essential vitamins and minerals are vegetables. 6 to 9 a day is really ideal. There's very few vitamins and minerals in any bread and cookies and meat and dairy. Refined carbs and sweets will deplete nutrients at an astonishing rate. And many of these, which we'll go through in a minute, will diminish brain function and they'll weaken the immune system. So ideal diet, 6 to 9 vegetables a day. Some whole grains, you want to be careful about that, and some protein, but really limit the carbs, the wheat, the gluten, and the sugar. Okay, and so the basic nutrition program that Linda and Angie use now and use with Lydia starts with around a good multivitamin. And so this was, I guess, Linda, we should probably add your story here about how you got connected to Shaklee products and then brought them to your home, because these were the products then that you began to introduce to Lydia when she was quite young.
That's right. Well, I first was introduced by when I had 2 very small children and 1 grade school child, and I found myself rather nervous and, it just seemed like I was stressed a lot. And I remember talking to somebody who then gave me your name, and I was connected to you, and you started me on B complex, that my happy vitamin. And I noticed such a difference that I was able to stay calm and not get as upset with the kids, and I liked myself better. And then because of that and talking to you, I was introduced to the Vital E, which was the multivitamin, and I liked all of it because it was so natural. I remember learning that it was really as though I was eating food. It's just like food because everything that Shaklee makes is natural. So I remember the vitamin C was like eating an orange. So that was what drew me to it. So I knew it was safe to start the kids on some of the supplements, which I started, with the Vital E.
Mm-hmm. So the basic multivitamin for everybody is Vital E. Those of you who have very young children, you would start them on the chewable form of that. And then there are a couple of nutrients that are particularly important for cognitive support for the brain, the nervous system. B complex is one, which is water soluble, and that thing is used up every time we eat sugar, refined carbs, alcohol, caffeine, medication, stress, all deplete B vitamins. Omega-3 fatty acids are essential for the brain. They are naturally occurring in the brain, and Americans do not snack on sardines and anchovies and fishy tasting fish very much, and so we tend to have a lot of omega-3 fatty acid deficiency, but it's very important for the brain. They're natural anti-inflammatory nutrients. The omega did that fast. And they're very important for healthy skin. And you remember earlier that Linda was pointing out that dry skin and eczema are issues often with Down syndrome, and as are inflammatory issues around joints.
I will tell you,
go ahead.
I'm going to jump in just on that. Lydia's every year seemed to be getting dandruff in the winter, always dandruff, and it was a real problem. And just since I've started the last, I'd say year or 2 years, she's been taking the Omega Guard, and I've noticed that she doesn't get that dry scalp like she used to, just because that heat would just immediately, when you turn the furnace on. So
sure.
It's
excellent.
amazing.
Mm-hmm, very good. And she never had the eczema either?
No, dry skin. She has dry skin.
Just a dry skin. Mm-hmm.
Well,
that's
but
good.
Not as much.
And then for the immune system, there are probably 4 or 5 products that are excellent for that. That is a great starting place. Is Optiflora, which is a probiotic, because somewhere between 70 and 80% of the immune system is located in the gut. And these are the folks who tend to have digestive challenges to start with, and so having a healthy flora in the intestines is critical for the immune system, as is the sustained release vitamin C. And these are all very economical too. And then regarding the muscle issues, the low muscle tone, the tendency to put on weight because of the slow metabolism, there is a wonderful array of protein shakes, and they all contain this special amino acid called leucine that the body uses to repair and rebuild muscle. So we're going to show you those in a little more detail. Anything else here, Linda or Angie, that you want to add? Oh, okay, good. Okay, Angie, was that you taking a breath?
Oh, Linda. I'm here.
Okay, so B complex. Linda, you started to talk about this. Was one that hit you a lot?
Absolutely. I mean, B complex was like my happy vitamin. It certainly got me through bringing up Angie and Lydia and Melanie without, stressing out.
That's right. And deficiency in B vitamins can cause mood swings, irritability, nervousness, fatigue, depression, mental confusion, headaches, anxiety attacks, cracks at the corner of the mouth, hair loss, joint pain, and because they're so important for the brain and the nervous system. Angie, anything you want to add here?
Sometimes because this is something you swallow, so my kids are 3.5 and 2 right now. So sometimes when I think that they might need some of this, I'll throw this in their smoothie when I blend it up and get it in there that way for them. And so I know that a lot of people on this call might have children that are too young to swallow vitamins. That's one way. Of course, you can crush it up, but it's
a little bitter, but that way is a great way to do it. Excellent, good. And then here's the fish oil, omega-3 fatty acids that we mentioned, so important for the brain, for the eyes, for the joints. Has some really interesting studies around ADD and ADHD, helps prevent memory loss and depression. We want to look for as many ways as we can to give cognitive support to the brain, to the nervous system. So that's one of the aspects of omega-3 fatty acids. And Shapley makes this in two forms: of chewable form for children called Mighty Smarts. I love that. And then the Omega Guard, which are capsules. And Angie, now you use these a lot with your kids, right?
I use the Mighty Smarts. They love their orange. They call it their orange vitamin. And it's the texture. I hate comparing things to Starburst, but that's the texture of it. So, and the flavor is very good. And my kids, I haven't heard of a kid not liking this vitamin yet. It's chewy and delicious.
And keep in mind that they help improve eczema, colitis, arthritis, multiple sclerosis, psoriasis, migraines. They're all interesting associations and studies that are being done around omega-3 fatty acids. So here are the Mighty Smarts in a little more detail. They contain DHA as well as the essential EPA and other omega-3 fatty acids. There's 7 actually, different classifications of omega-3 fatty acids, and they're these kinds of fatty acids are found in the oily tasting fish, which is not always a first choice by kids or adults for that matter. And these are certified organic. They're really a very healthy choice, really quite nice. Here's one. Go ahead.
About the Mighty Smart was what Angie did, and that was in order to get that probiotic in them, which is just a little tiny pearl. She stuck it in there and kind of hid it in there and gave it to them, and then got that down them without them even knowing.
That was a genius, right?
Yeah.
So the probiotic, which will come in just a second, she is the size of a pearl, and important for young children. So that can be inserted inside this little orange Mighty Smart, and kids just chomp it right down. That's very good. This was a study done at the University of South Australia with children who were put on omega-3 fatty acids, and they saw quite significant improvements in attention, behavior, their vocabulary, their concentration. They were less impulsive. They were more calm. Dyslexia improved, and depression. And 60% of the brain is made of fat. So this is the Shaklee Omega Guard. I wanted to mention this because fish oil is very trendy right now, but you have to be awfully careful about the brands that you buy. Consumer Reports issued a report earlier this year that about a third of the fish oil products that they tested did not meet their standards of even just having what was inside the capsule line up with what they put on the label. They contain lots of contaminants. They had less amount of the actual omega-3 fatty acids than they said on the label. They often had vegetable oil in them to dilute the essential fatty acids, and the consumer is really quite at risk for these things. Shaklee, on the other hand, conducts 100,000 quality control tests every year, and they test for over 400 contaminants, where the U.S. Pharmacopoeia, that kind of sets the standards for the industry, recommend testing for 80. Shaklee tests for 400. This is why you get such purity with the Shaklee products. There was a lawsuit that was brought against a lot of fish oil products just 3 years ago now, because failure to disclose the contaminants that they contain. So, Angie, there's the Optiflora.
Well, we've touched on a lot of what the Optiflora is good for, but like Barb says, since 70 to 80% of our immune system is in our gut, it's really important that we keep our gut healthy. So if someone has ever been on an antibiotic, or they have issues with diarrhea or IBS or any sort of intestinal issues, it's a sign that they really need to get their gut flora back up with the good bacteria. I think actually everybody could benefit from a probiotic. It would not hurt for anyone to take a probiotic. Yeah. So I recommend anyone I talk to include this in a baseline nutrition plan.
And I think I have a picture. There it is.
Yes. Mm-hmm. The probiotic, because it's important to your gut, it has to get through your whole system to your intestines. A lot of probiotics that are on the market or in our food don't always make it to our mouth, let alone through our stomach acid. They need to still be alive by the time they get to your intestines. So Shaklee has developed a triple encapsulated way that they cover these good probiotics. I can't think of the right words right now.
Technology.
Technology. Right there on the screen. I should read. So as it's going through your system, it slowly, the first layer comes off, and then when it goes through your stomach, the second layer comes off. So that by the time it gets to your stomach acid, your intestines, that's where it's released and does all of its good stuff down there. The other thing I like about our particular probiotic called Optiflora is, like Barb said, it's so tiny. It's like a pearl, like a small pearl. So my 3.5-year-old is learning how to swallow vitamins with this. So it's so small that he can do that. And I've even given it to my 2-year-old Eliza when she was like a baby, and I would soften it and stick it in her baby food or a spoonful of breast milk to give her, to get down her, and it's completely safe.
Mm-hmm. It's wonderful. And these are some of the things that Optiflora and probiotics are good for, from flatulence and bloating and constipation that Linda mentioned earlier, abdominal issues, digestive issues, children who've been on the antibiotics. All of these things are really, really helpful. Then comes sustained release C, we mentioned earlier, very important piece of the immune system, but lost to stress and alcohol, smoking, birth control pills, infections, illness, and pollution. I'll tell you, across the country, we have had these horrendous heat waves this year. And when it's very hot and muggy like that, it holds the pollutants closer to the surface of the earth. It's really important for all of us, children and adults, to take extra vitamin C, extra vitamin E, extra antioxidants to help protect against all of those the pollution. So here are just a variety of the protein products that Shaklee makes. They're just a wonderful way to get nutrients into these children and into any family members with Down syndrome. But for all of us, it's just, they're healthy, they're delicious, and they build cells. And the ones in the Shaklee 180 line have that leucine in, especially important for building the muscle tone in the people with Down syndrome. Anything you want to add here, Linda?
Well, I will just say that I have been taking before they came out with the 180, the energizing soy protein, probably for, close to 15 years or so. That was my breakfast. And it's so easy. And now with the 180, with the leucine in it, it's so much better especially for the population of people who do have Down syndrome because of the slow metabolism. And this is what Lydia has every morning. She has a meal, they call it her 180 shake. And she loves it. Sometimes she puts a banana in it. Sometimes she puts some frozen fruit in it. And she loves it because she can mix it up and make different recipes. And it lasts her until lunchtime.
And I was just thinking, before her wedding, what did she do, 13 pounds or something like that, right?
Yeah.
From that, and I think doing the bars at lunchtime and so on.
Exactly.
Very good. Okay. And then additional supplements for some of the other things that Linda mentioned. Vitamin D, of course, is good for the immune system, it's good for the bones, the heart, the brain. Herblax is a wonderful product, 9 herbs that help improve elimination naturally and gently. That was one of Dr. Shackley's original formulations. Joint Health Complex is a great glucosamine product, which helps repair cartilage, and the boswellia is an herb in that significantly reduces inflammation and thus pain. They also have a wonderful cream that it's kind of a menthol-based cream, but it absorbs very readily into the muscle, into the joint, and it just brings immediate relief. Nutriferon is also a remarkable product made of 4 herbs that really boost the immune system. Anything you want to mention here, Linda or Ange?
I want to say the joint and muscle pain cream, the chiropractor that I was going to, he really likes it. He was working on my arthritis in my hands, and we were doing some soft tissue work, and he really liked it over and above the BioFreeze, which is what a lot of them use. He thinks it was much better because it was absorbed into the skin and through the layers, much better. And then, and that the Nutriferon, I think that's should be almost a daily vitamins for people with Down syndrome, only because that immune system is so, I don't know, it's not fragile, but it just seems that they pick up a lot of germs quicker, and it takes longer. I remember when she was little, it seemed like it took longer for her to get over a cold if she got one, where Angie would get over it much quicker. So I think that their whole system is just on slow motion. And, this Nutriferon, she takes 2 every day. I'm so happy they came out with it.
Good. Now we wanted to spend just a couple more minutes talking about the special behavioral issues that folks have to deal with when you're raising a family member with Down syndrome. And Angie, why don't you start us with some of the issues that you had to deal with Lydia?
Okay. So I think a lot of the advice on this particular screen is applicable to any parent with any child, Down syndrome or typical. But what happens, I think, is where with a typical child, you might stop telling them to eat with their mouth closed or wipe their mouth by the time that they're 6 or 7. But sometimes with people with Down syndrome, they're still having some of those behaviors at 16, 17, 18, or even sometimes longer. And they don't pick up on the social cues that they shouldn't be doing those things, or that, but at the same time, they still have feelings and would get embarrassed, by those actions. So, for example, I remember growing up, Lydia would eat with her mouth open, and we would, instead of saying, Lydia, don't eat with your mouth open, because that would embarrass her and it's rude, and I would just look at her and I would put my one finger over my 2 lips, and she would look at me and she'd notice it and she'd eat with her mouth closed. So nobody else knew I was doing that but Lydia, and so she knew to correct her behavior because I was kind of giving her that signal, but I didn't have to embarrass her in front of everybody. And so sometimes I think that, and even now, Lydia's 35 and I'm 33 and we're adults, but sometimes now even I forget that she's 35, she's my older sister, she's married, she's doing all these things, and I will talk to her like she's 16 again. And I think that's important to remember that in order to expect them to have age-appropriate behavior, we also need to treat them like they have, like the age that they are. And,
with high expectation.
Right, high expectations and with respect, and in the way we would want to be talked to. If I'm eating with my mouth open, I wouldn't want someone to tell everybody at the table that. So, I shouldn't tell Lydia that either. Where I might say that to my 3-year-old in front of people, but I shouldn't say it to my 16-year-old or my 35-year-old sister. So I think that's something important to keep in mind.
Very good.
Go ahead.
Go ahead.
I was going to say, at the end of the slide, it says people with developmental disabilities are more likely to lose their job. So I think that's not only for friendships in school and while they go through school in the social ways that manners and those kinds of things are important, but when they enter the workforce, we would hope that our children are being accepted socially, but also acting socially appropriate so that they can do
so
a better
they're not
job
at risk.
Accepted.
Yeah.
Right.
Isn't that interesting? Yeah, that more people with developmental disabilities will lose their job because of their inappropriate social behavior while they're on the job than lack of skill. That's really quite a statistic.
Yeah,
Okay.
there are studies done on that too. And I guess for just to add, oftentimes our kids with Down syndrome are so darn cute, and they are just precious. But when they start doing things, just remember when you laugh at him, and you laugh and you say, "Oh, look, isn't that cute? No, that's so funny. He's got spaghetti all over him," or whatever. That they're getting positive reinforcement, and sometimes that is harder to erase as they get older, and it's not so funny when they get older. So just we have to remember that, and even though it doesn't seem as fair as it should be at that time. I just saw it too many times.
Good. Go ahead, Linda.
All right, parenting tips, and I guess I'll have to go quickly through this. To partner with the teachers and therapists and the family, so all the messages are consistent. So, if you're working on a goal, then everybody knows how we're going to work on that goal. If it's interrupting, then we have a saying, for instance, "Johnny, give me just a minute so I can finish talking to Mary. Please wait patiently." So I'll say that, teacher will say that, therapist will say that, so the child is not getting too many mixed messages. And for people with developmental disabilities, it needs to be clear, simple, and to the point, and consistent. It's very important to be consistent. And so, I won't go through the whole slide. You can read it. But, our kids with Down syndrome, it's not uncommon for them to become little escape artists. And so when I was running a conference, we had to be very careful when we had our adults with Down syndrome and our teenagers with Down syndrome having their own conference, that somebody was always watching and making sure that, nobody got out of the, the facility because they'd be on a busy street or something. So, that's something that we have to, in order to teach them, you might want to role play something like that. And you do it with the teacher, you do it with the parent, everybody role plays it. Okay, so how do I ask to get out of the room? If I need to go to the bathroom or I want to get out of the room. And then you tell them the expected behavior, you model it, you actually do it, and then they do it. And it really is theater. It's really playing it out. And then, of course, be the model in everything you do. I think I couldn't get over what an imitator Lydia was. If she saw us doing one thing, she would pick up anything. She was like a mirror. And so, you have to be really on your best behavior. So if you want them to wipe their mouth when they're eating, you better be doing it. If you don't want them to be, if you want them to sit down and eat rather than walk around and eating, then don't you sit there and eat your sandwich while, you're walking around the kitchen and then expect them to not do that. So as a parent, you really have to be the model that you expect of your children. But this is really important, that behavior sometimes may reflect a medical condition. So you really have, and they may not be able to communicate that to you, and you really have to be aware of it. And I would always have that checked out before I just assumed behavior was just behavior. I would always, the first thing you look at is underlying medical problems. And seek first to understand undesirable behavior. So it's a form of communication, and the kids are going to, if they can't tell you something and they're upset, they're going to start acting out. And if they won't, if they refuse to comply, your first reaction is to say, just do it. But if you realize that, why they're doing it, and then we can get the behavior to change a little bit better if we understand what's causing it. If you were, I often tell people, just pretend you were in a different country that you don't know how to speak the language. Like for me, it would be China. I wouldn't understand anything people were saying. And if I didn't, and they would get frustrated because I wasn't doing something they wanted me to do, at times you might just have to just act out and just show your frustration. And so little kids and often older kids will let you know that they don't understand what you want them to do. And or they don't want to do it because they're scared, and fear is a real important one. I don't know whether we go through the stubborn one. Being fearful is huge, because if I don't move from where my position is, I know I'm safe here. But now you're asking me to do something that I haven't really had a chance to actually think about. So understanding that behavior, I think.
Good. Okay, great.
And it is a form of communication, and it's in all of this. It can communicate about health issues, that they might have an infection in their ear or whatever, sensory issues, that they don't like the cottage cheese because it's kind of creamy and they don't want that. We talk about, again, the people will say kids with Down syndrome are stubborn, and stubborn has such a negative connotation. Kids with Down syndrome don't move off of their position because usually of fear. And if we can help them understand that what we're asking them to do is going to be safe, and we give them time, that's the huge thing, is giving them time to process that request and understand it, and then being able to come back with a response. That is huge. And then I think a lot of people have heard of the groove. Our kids with Down syndrome get into what's called a groove. We used to call it a rut, but it's really a groove. It's like, I'm always going to do this. My glasses are always on this part of my nightstand, and don't move them. We have to help them become a little more flexible sometimes, and sometimes being in a groove is a really safe and good thing. And then transitioning from one activity to another, a lot of, warning, in 5 minutes we're going to be going in from the playground, that sort of thing. I think we're kind of, I'm talking fast because I think we're running out of time. So,
but I'm sitting here thinking, these are really good suggestions for anybody with children, with any children. They're kids always do better when you let them know ahead of time what's to happen, what's the behavior that's going to be expected. It's going to be safe. It's always a good idea. I think that's true for all children. It's
exactly.
very, very helpful.
A great example that I give all the time is Lydia. As she was older, I'd say, I'm going to go to Walgreens now. You want to come with me? And no. She would always say no. Doesn't want to, no. And if you realize that our kids often say no because it's making them move from their safe position that they're in right now. But if you give them some time, because it'd be so funny, by the time I'd get my coat on or I'd get the keys, I'd hear her go, I want to come. And so what she's had that nice delay of time to sort of process, wait a minute, I think I do want to go. That might be kind of fun, So I think it's allowing them that time to process is so important.
Excellent. Go ahead, Angie.
Well, I have, like I've mentioned before, my whole family's on, myself, my husband, my kids, we're all taking Shaklee. You're hearing my mom tell you that I grew up on Shaklee vitamins with Lydia and my other sister. And so I've always trusted Shaklee as a brand, but as an adult and researching it to give to myself and my kids, I realized that Shaklee is really based on safety and purity and science. And when I learned all of those things, it made me feel very comfortable giving them to when at the time I started giving Joey some Shaklee vitamins when he was 15 months. Took them all through my pregnancy with my second child and gave them to her as soon as I could. And so I feel very comfortable with that. I also feel a huge personal responsibility to our Earth, the planet, to the health of my kids and kids all over the place. I feel like a huge passion for that, and learning more about Shaklee, I found that is a huge passion for them too. So all of the products are safe, but also they're good to the earth. We have a lot of processes in place to make sure that we're being kind to the planet. So I feel really good about this company, and I'm glad to share that with my kids and my husband and people I love.
Good, very good. Did we cover this? Linda, could you just mention that 10-second rule? I thought that was such a good suggestion.
Because the processing takes a little longer, I tell parents often just be really patient. And in order to do that, you say, do you want to come to Walgreens with me? Then you stand there and you count in your head to 10. I call it the 10-second rule. And then wait to see if they'll respond. And if they haven't responded by then, you might repeat the question, or you might say, do you need some help deciding? And you'll be back in time for dinner, or no, we're only going to be gone, for 10 minutes, and that's a short time. So sometimes it's helping them come up with, the thought process. And as they get older, I've seen Lydia just gets much better at it and doesn't
very
take
good.
10 seconds.
So a good starting place for those who can swallow is the Vitalizer. Many of the nutrients that we have just talked about are in this one daily strip. And I do want to mention this is such a remarkable product because many vitamins are absorbed in the stomach, others are absorbed in the small intestines, others in the lower intestine. Some are fat soluble, some are water soluble. Some need an acid environment, some need a basic environment. This is a very tricky thing, and that is what Shaklee is known for, is absorption. And that's what that diagram on the left is describing, where each of the tablets that are in this daily strip of 6 tablets, each one is designed to break down at exactly the right place in the intestinal tract for maximum absorption. And that's why there are so many patents on this product. They are based on some really amazing studies. There's over 12 clinical studies on it, and they contain over 80 bio-optimized nutrients, which means they're very well absorbed. Lydia, just very quickly, this was what Lydia takes today. Anything you want to say there? Mm-hmm.
Yeah, and I would say she's 35 years old, and so that we've worked up to taking more vitamins. When she was little, it was much fewer. But then she's taking like the joint health complex because her knees are starting to hurt her at 35, and the B complex keeps her from getting too worked up when she works full time, and then sometimes there is some pressure on her, so she gets a little nervous. So she keeps a little B complex in her purse, and sometimes she'll take a little extra. The Vivix, we haven't talked about it. It's a product that should help her, hopefully, with her memory as she gets older. And she likes the mental acuity because she says it keeps her sharper. And,
cute.
And the GLA was once she started, having her periods. Sometimes she had cramps and that sort of thing, and bloating. And once she started taking that GLA, it was not as bad. And the osteomatrix is, for her bones. She is 35, so we do have to, and that helps her sleep. That osteomatrix, she'll take 4 of those chewables before she goes to bed, and it really does help her just kind of calm down and forget about any of the worries that she might have, and she can fall asleep.
And this is a calcium and magnesium and mineral product. Good. Mm-hmm.
Yeah.
Excellent.
And then, yeah. Mm-hmm.
Okay, thank you. So, and then just to wrap up, build healthy bodies for happy and productive lives. A good diet with lots of vegetables, 6 to 9 a day, adequate sleep. Make sure that the sleeping routine is respected. Calcium before bed, really helpful. Exercising, avoiding toxins. Those of you, we didn't have time tonight to talk about the Shaklee Get Clean cleaning product line, but they're very economical, but they are all non-toxic, completely safe. Very important for all of us.
And see, there again, she's an adult, and she's on her own, And I'd never worry about when she's, I'm cleaning the bathroom today. I don't like, oh my God, I hope she doesn't put too much on her hands. Or it's so nice.
Yeah, and then to teach the children well, right? Help them make healthy choices so they can live independently and function independently, and then the supplements that we've talked about today to help them give that extra nutritional support. And with that, it is a wrap.